Welcome, everybody. It's Katie with Embody Daily, and today I am here with a friend and fellow TSM doctor, Dr. John Umhau. He runs the website alcoholrecoverymedicine.com, and he and I have become friends over the past year or more. I just see you as such a compassionate, knowledgeable, educated, passionate TSM doctor, and you incorporate other medications outside of naltrexone, as well as nutrition as part of helping someone through the challenge of alcohol addiction. So I'm so grateful to have you speak with me today. And I just wonder if you could kind of give us a little bit of an intro on yourself and your background in the space of alcohol recovery medicine.
Oh, thanks, Katie. Hi, everybody. Yeah, I got really interested in alcohol problems when a good buddy of mine in high school died from alcohol problems. And I just was always interested in helping these folks. So when I was doing my preventive medicine residency at Johns Hopkins, we had a number of months of our medical training in addiction. So I spent a lot of time going to Alcoholics Anonymous meetings. Once a week, we had to go to different Alcoholics Anonymous meetings. And I really got interested in hearing people's stories about how they had overcome alcoholism. They work in the 12 steps, they were building their character, they were humble, they were caring about other people. They wanted to be the best people they could. And I really resonated with that as a part of the important therapy for alcoholism. Um, Later on, I ended up working for the homeless and street people in Baltimore and DC, and I got really interested in the problems of alcohol because we didn't have anything to treat people with except abuse, which made them sick if they drank. But a lot of times they'd want to drink so much they'd drink in spite of that. So when a buddy of mine, Ted George, asked me to come help him at the NIH doing research on alcoholism, I jumped at the opportunity because I felt here was an opportunity to really make a difference. And that was like almost 30 years ago. And it's been fascinating to see all the advances that we've accomplished in treating alcoholism since that time.
So what's the evolution of your experience researching naltrexone, like from when you started to now?
So yeah, naltrexone was exciting because it was the first new medicine we had for alcoholism. And so it came out in 1995, and I was one of the first guys to use it. I was warned that it didn't work that great. And in fact, people didn't like to stay on it very long. But I did use it on some folks who had been off alcohol for a week or so. And it seemed to really work. One guy came back a few years later and said, thank you, Dr. John, it really did help me stop drinking. And what we'd been told, though, as doctors, is that you only should use naltrexone if someone had been off alcohol, preferably a month, preferably out of detox, and you start them on naltrexone, and that's how you're supposed to use it to help them prevent relapse. We didn't know anything about using it to control drinking at the time. We didn't have any knowledge about the Sinclair method. But over time, as the research came out, the standard way of thinking about alcoholism treatment, which was to promote complete abstinence and promote the 12 steps, there was more to it than that. The research showed that, in fact, some people could moderate their drinking. This didn't really fit with what we were seeing with our severe alcohol patients on the ward. So we really didn't recognize that as being a great idea. So I didn't really embrace anything but complete abstinence until later on when I realized that there was a real benefit to some people when they took naltrexone. I had a buddy of mine that wanted some naltrexone because he needed it so that he wouldn't get drunk at his business meetings. He ran a company, and when he took the naltrexone before his business meetings and had a cocktail, he wouldn't drink so many that he would embarrass himself, because otherwise he'd get sloppy drunk and he couldn't run his business meeting. So he wanted naltrexone for that reason, and sort of made me. It started to make me think about alternate uses of naltrexone other than just to keep people sober who had been through a 28-day detox program. So when I first heard about the Sinclair Method from Jenny at the C3 Foundation, she had a booth at a ASAM meeting, And I said, wait a minute, what's this? And she described how Sinclair had recommended that people use naltrexone to reduce their drinking, and that it gradually would induce an extinction of the drinking behavior. It would reduce their craving over time, that would allow them to kind of get free of the alcohol problem. And it made sense with research, because I knew that from research that if you were able to stop drinking with medication, you'd eventually lose your craving for alcoholism and go on.
That's awesome that you learned about it from Jenny. I didn't know the history there.
Yeah, yeah.
So because this method is so unconventional to what we've typically been told, and what you were told, it sounds like at NIH, is abstinence with the medication, or abstinence in order to overcome alcohol addiction. Do you think that this is why it's taken so long for naltrexone and the Sinclair method to take traction in the recovery space?
Well, yeah, it's very different than the way that most people think in the alcohol recovery world. Certainly, it was different from the way that I thought when I was active in research at NIH. I thought you had to be abstinent. That was the only goal that you could have. But now we realize that you can reduce the harm from alcohol if you just don't drink as much. And it sort of makes sense, but at the time it's kind of radical, and it still is radical for people in the programs. You know, the alcoholism world is full of stories of people that have tried moderate drinking and then failed. And I've seen many patients who are successful with the Sinclair method and then drank beyond the effect of the pill, or they forget their medicine, or something happens and they relapse. And there's really no research to show that naltrexone works as well the second time around as it does the first time. And I'm very concerned that people stay safe. So if someone has a problem with alcohol, I recommend they just stop drinking. You don't have to. And I tell my patients, you know, you don't have to stop drinking, but I think it's safer if you do. Certainly the thing about naltrexone is it allows people to get free. So that they can make a choice. When they first come to see me, if they think about stopping drinking, it's they can't imagine it. They think they'll die without alcohol. But over time, and the craving goes away from the use of naltrexone, the alcohol loses its hold on their mind, and they can say, "Yeah, it's probably a good idea for me to quit. I just think I'll quit. I don't need to be a drinker anymore." And that's really, really the most wonderful thing about naltrexone therapy.
Yeah, I would say that was true for me. Like, the thought of quitting alcohol was just, I tried a lot, but it was very hard to fathom. I was like, no way, life will suck. But with naltrexone,
That's right. That's right.
after taking naltrexone, I was like, oh, okay, I can do this. And it was actually like accidentally done. So it's pretty amazing how it, like you said, it takes away the grip of alcohol.
Yeah,
Um,
a lot of people say they just don't want to think about alcohol anymore. They want to be free of that. And, you know, they may not drink that much, but they don't want to be consumed by the thinking of it.
yeah. So what do you say to family members or skeptics of someone who wants to try this method? Say they've tried abstinence, AA, rehab, and nothing's worked, but the family is hesitant because you still drink on this method. What would you say, especially with what the research shows and what you've seen in your practice, about giving this method a try?
Well, I think probably the most effective way to talk to families is have them watch Claudia's TED Talk about naltrexone, or her movie about One Little Pill. It's a great way for families to really kind of see that there is another way of approaching alcoholism. And I think people pretty quickly recognize that if their loved one's drinking less, and they're less hungover, and they're less belligerent when they're drunk, they see an effect pretty quickly, and it tends to be very reinforcing.
So would you say that naltrexone is a safe medication to take? I get that question a lot. People are concerned about the impact on their liver, and if there's interactions, and just if it's safe in general.
It's a kind of cool drug because it's specific for what it does. It specifically affects the opioid receptor, so that it just blocks that. Of course, there are downsides with that, and different people react different ways. So you probably know lots of people get nausea or little headaches, maybe some sleep. Sometimes they get anxious, and that's no good. Sometimes they have to stop it because they're anxious. Probably the thing I worry about most is when they get depressed or even maybe suicidal from the naltrexone. They have to kind of stop it. Then I go to other medications like Topamax or ondansetron. One of the interesting things about naltrexone that I have begun to really appreciate is that it really works great for people who are compliant, who really will take the medicine, who aren't half-hearted about it. If people are half-hearted about it, there's a problem with it. Okay, so I had one patient who didn't want to drink Monday through Friday because he had to go to work, and so the weekend, it was his birthday, and he wanted to celebrate, so he didn't take the medicine. And instead of drinking, what he might have consumed before, 10 drinks, he drank 40 drinks. And he said, Doc, it tasted so wonderful. I'd never had that much alcohol at one time before. It just tasted amazing. And what had happened, of course, is that the opiate receptors were upregulated by Saturday night. And just as we look in the Sinclair method to do pleasurable activities on naltrexone-free days, because the opiate receptors are upregulated and you'll enjoy whatever behavior it is. If you drink on those days, you'll drink more than ever and it'll be more pleasurable. And I think that's probably why the medicine naltrexone doesn't work that great all the time, because people are taking it just whenever they feel like it. So for those folks, I don't recommend naltrexone right away. Or maybe I'll recommend it like Dr. Harry suggests, it's just every day. And then after they get to the point where they can be really compliant, then they'll take it as needed. The other thing to think about is that maybe another medicine like ondansetron, where they take it twice a day, just gradually reduce the drinking, or topiramate would be most effective for those folks because it doesn't affect the receptors that much. So, but to get back to your question about naltrexone, is it safe? Yes, it's a safe medication. It does affect the liver sometimes, but not very often. And it's almost safe enough to be prescribed like what they call over the counter without a doctor, but not quite. There's another medicine called nalmefene, which is available in Europe, which is also fairly safe too.
Yeah, thank you for explaining that. And I do remember in the talk you did at the C3 conference last year, you spoke about how, like, when you're just taking naltrexone whenever you feel like it, meaning sometimes you're drinking on it and sometimes you're not, how that can just really kind of kick someone off the path, because when they're drinking without it, sometimes it's like super pleasurable and super reinforcing.
Right.
And then they're not, or drinking on it, and then it's blocked. So that just really sunk in with me, and just proves the need really to take it with regularity and to not skip those doses. And whenever I see people skipping doses, that's always the first thing I ask if someone's struggling on the method is, how compliant are you? Because if you're not, why are you doing the method to begin with?
Yeah, no, if you're not using it the way that we talk about every time you drink, probably better to switch to different medicine. I would recommend ondansetron or topiramate, something like that, because it's not going to be helpful. And it's sad because they need help. They just have such a drive to experience the alcohol effects that they can't remember, or they don't remember, or to take the pill all the time.
So I've heard you talking about other medications, which it's really exciting because sometimes people are afraid that naltrexone won't work for them, like the standard 20% it doesn't work for. So there are other medications, it sounds like. And I know you've mentioned to me that you've had success with other medications. So can you speak on that a little bit?
Well, sure. We have a lot of medicines that work for alcoholism now. It's great. I mentioned topiramate and I mentioned ondansetron, but there's also varenicline works sometimes. Baclofen. A lot of people get help with baclofen. I'm really interested in these blood pressure medicines, these alpha blockers, prazosin or doxorubicin. It's another pathway that works to help people not drink. And again, Dr. Harris is one of my colleagues in the alcoholism treatment world, and he and I both agree that we've never found anybody that doesn't respond to something. I'll see oftentimes people that don't have a good response to naltrexone, and we'll find another medication that works for them, and they're happy, and they come to extinction just like they would as if they'd been on naltrexone.
Wow, that's really promising. And I'll write out all those medications below this video so people can look them up and do research for
Sure.
themselves.
Yeah,
Um,
so a lot of people come to our website, the alcoholrecoverymedicine.com website, because I've got all those listed there. So, and I kind of explain the pros and the cons of each one.
Perfect. Okay, I'll link to that also then. I didn't realize they were on your website. So how would people say, they're going to their general practitioner to talk to them about these medication treatment options? How would you recommend someone approach their doctor with these requests? Because I know a lot of people, their doctor refuses to prescribe them anything for alcoholism. So what would you say to them?
So that's a good question. A lot of doctors want to do the right thing, and they're concerned that they're going to be writing prescription and the patient won't get better at something. So most physicians that you might be thinking of might be internists or family practice doctors. And so if I were a patient, I wanted that prescription, I would probably go to a family practice journal or an internal medicine journal, and I would find an article about using naltrexone, and I would print it out and I would take it to the visit and say, here, doc, I want to try this medicine. And they'd look at it and they'd say, wait a minute, here's from the American Journal of Family Practice telling me to prescribe naltrexone. I guess I can do that here, have a prescription. It helps the doctor kind of know that it's okay for them to write the prescription. But the other thing they can do is just like my patients come to the alcoholrecoverymedicine.com website and read about it, because I put a lot of stuff on my website that's just for educational purposes.
Okay, that's awesome. Thank you for that. So one specific question about the dosing of naltrexone on TSM, I've understood the standard kind of therapeutic dose to be 50 milligrams at least 1 hour before drinking. But I know talking to you recently, you mentioned how you have people on different doses, lower than that or higher than that. Can you speak to that just so people are aware that maybe it's not a hard and fast rule of 50 is the only dose you need?
So that's a good question. A lot of people think that there's just one dose for everybody, but there's really such individuality. Different people metabolize the naltrexone faster. Some people are using strong drinks like vodka, and some people are using a wine that has only a few percent alcohol. So people's need for the opioid blockade that naltrexone provides is really kind of different. And so it depends on how long people are drinking, depends on how fast they drink too. So it's sort of individualized. Some people find, Dr. Harries agrees with me that the use of naltrexone in someone who's a heavy daily drinker will probably create more side effects than somebody who's just like a binge drinker. So if you've been using alcohol every day, it's causing endorphins to be released every day, all the time. And that's sort of the same situation that you would have if you were an opiate addict. If you were an opiate addict, you wouldn't want to take naltrexone because it would put you into withdrawal instantly and you'd feel awful. So someone who's taking alcohol every day has the same effect. They'll feel awful when they start naltrexone. To kind of overcome that, a couple things can happen. They can try to go for an alcohol-free day before they start naltrexone, but probably it's easier to start at a really tiny dose. You may be aware that people do use low-dose naltrexone as an anti-inflammatory drug, and you can start taking naltrexone at a very small dose and work your way up to a dose that blocks your craving for alcohol. Of course, there's the other thing too, is that if you're drinking all day, the effect of naltrexone is going to wear off. It may wear off in 2, 3, 4, 5, 6 hours, but at some point it'll wear off. I remember when my first patients, a nurse that I got to know really well, she and I, she didn't want to be in my office. She didn't want to deal with alcohol problems, and she didn't want to take any medicines. And I said, yeah, I get it. Here, let me tell you about this Sinclair Method thing. And we both read about it, and she said, yeah, I'll try that. Let's do that. And so 6 months later, she was at extinction, and it was great. But she didn't stop drinking entirely, and she had a wedding she went to, and she took a pill before the wedding, which was at noon, and after the wedding there was some champagne, and then there was some partying after in the afternoon, and there was dancing in the evening, and more champagne. And 11 o'clock, that champagne tasted really good, and she just did not have any effect with the naltrexone at all because she hadn't taken it for 12 hours. And the next day, she remembered how wonderful she felt with the champagne, and she didn't even think about naltrexone. She just picked right up on the drinking. Now, she had done everything just right. She had taken the pill before she started drinking, but she drank so long that it was overwhelmed. What we call the naltrexone wall was broken down over time. Yeah, the same thing can happen, of course, if you take the pill and you drink stiff drinks. Like, you can overcome the naltrexone wall and you can feel the buzz just as if you had not taken the drug. And those are things I kind of worry about with the dose. So sometimes if someone takes a stiff drink, and that's all they want to drink is maybe only vodka or whiskey, then they need maybe the higher dose.
Okay, that's really interesting. And to hear you say that people who've been drinking heavily every day may have more side effects on the naltrexone, that's interesting. I didn't know that.
That's my clinical experience, and
Yeah.
it makes sense. And that's probably why when I first used naltrexone back in 1995, nobody had any side effects from naltrexone. There was no nausea or vomit, none of that stuff, because they didn't have the same opioid situation in their brain. They didn't have the chronic endorphins.
Because they were abstinent when you were
Because
doing
they
it.
were abstinent, right?
Okay.
Right.
Interesting. So does naltrexone, I know you talked about this a little bit, but does it impact other pleasurable activities or
Well,
mood?
it does. Yeah, it sure can. As I mentioned before, sometimes it can make people feel sad or depressed over time. But the beauty of the Sinclair method is that since you don't take it except when you're drinking, the that's not such a big bad effect. And you have, particularly for somebody who's a more binge drinker, you only get the naltrexone effect when you're drinking, when you need it. And that's the beauty of it, because you can keep doing that forever. If you have to take naltrexone every day, life is kind of blah after a while. And that's the reason why people in the olden days, when I first gave it, wouldn't take it all the time. They wouldn't take it more than a month or two.
Okay. So that's kind of the importance too of alcohol-free days, to get it out of your system and get some natural endorphins. And
Exactly. So after about 24, 48 hours after your drink, after your last naltrexone pill, is pretty much out of your system, and things that are pleasurable really feel pleasurable. Of course, you have to watch out. Again, the side effects of naltrexone is that it will block opiates, so that if you break your arm and you have to go to the hospital for a morphine shot while they're setting your arm, and you've just taken naltrexone, it's not going to work. It may take a week for the medicine to get out of your system before you can safely expect that like a morphine would work. Say if you're going to have elective surgery, you want to make sure that you switch to a different medicine, maybe like toprimate, to take before your surgery, so that the anesthesia is going to work.
yeah. And just like, because I get this question a lot of whether it impacts pleasurable activities or mood, is that a side effect from your experience that people should really be concerned about, or they should not do the method because of that fear of that side effect? Or what are your thoughts?
Well, a lot of people don't have any problem with that whatsoever. They don't notice that. So it's a minor issue for some people. And certainly if somebody's a daily drinker and they feel like it's bothering them, there are other medicines to try too. And maybe, for instance, they would start with a different medicine like ondansetron or toprimate to start with, and then after they get some alcohol-free days, then they can start using the naltrexone in the Sinclair method to kind of finish up the extinction. And this is kind of some of the things that someone who's familiar with the different medications can help them with.
Okay. Yeah, thank you for that. So what about, I know you're big on nutrition and you've done a lot of research on this. So, and I heard you tell me a story a couple weeks ago where I think I'm getting this right, where one woman was still kind of battling cravings. She may have been on the Sinclair method and you recommended her to start a fish oil every day, and that really changed things for her. So I'm curious if you can speak about nutrition and supplements and how that impacts someone's recovery from alcohol.
So thanks for bringing that up, Katie. I think the nutrition is probably way more important than the medications for someone who wants to recover. I just have had so much experience. And the reason is because once you're off alcohol, you still have to think clearly to remember what you want to do. Drinking is has an effect on our opiate system, so we become addicted. So our subconscious craves the alcohol, and that's sort of the lower part of the brain. We can overcome that if our willpower is good. Well, what is willpower? Willpower kind of comes from our frontal lobes, the top part of our brain, which can then communicate to the rest of the brain through these white matter tracks, these long nerve axons that tell the lower part of the brain, hey, no, we're not going to drink. You know, we're going to white knuckle it. We're not going to have a drink now. It's okay. It's important not to drink. All those thoughts come from a certain part of our brain. And if that brain is not working great, then the addiction can take over, the craving can take over, and you just kind of go with that. So the people that in my program, they all have good willpower. It's just that it's not strong enough. And what makes the willpower strong enough is a better brain, a stronger brain. And what makes a brain stronger is probably related to the ability of the brain to grow new neurons. And that comes from a situation in our brain that's characterized by, well, for instance, one neurochemical called brain-derived neurotrophic factor, or BDNF. BDNF helps new neurons grow. It helps the processes from the nerves grow, and it allows you to form strong new memories. And if you don't have that, it's really hard to change your habits. It's really hard to decide to do what you want to do. And it also promotes the transmission of impulses from the frontal lobe, where you've got your willpower, to the more lower craving centers. Now that's important because when you have good nutrition, particularly high omega-3s and a reduction in all the inflammatory mediators that are caused by poor nutrition, then the BDNF is not present as much. Instead, your brain has the thought or the situation where it's fighting off infection. Sounds like I'm getting pretty complicated now, but I really want to explain that our diet drives all this. And it's not just that, oh, well, you should eat a good diet. There's a reason for it. There's a biochemical change that occurs in our guts when we eat processed food, where we eat food that's got high omega-6, where we eat high fructose corn syrup foods, and all these chemicals and toxins in our foods. All those things affect the normal bacteria in our gut, and that allows the gut bacteria to be more predominantly gram-negative. And the gram-negative bacteria produce what's called endotoxin, maybe other toxins too, but this endotoxin, or this debris from dead gram-negative bacteria, is a very strong inflammatory signal that gets into the brain, gets into the bloodstream. In the liver, it goes to cause fibrosis and liver cirrhosis. And in the brain, it can cause inflammation. And what happens in the brain is the brain thinks, hey, there's an inflammatory response going on here. Maybe there's a bacteria, we need to fight this off. So what the brain thinks to do is to create more white cells, create more inflammatory mediators, and cause a different state in the brain than one that can grow with new neurons. It's fighting off infection. So what the brain does is actually kill brain cells sometimes, and those the debris from those brain cells can cause even more inflammation in the brain, causes the brain to deteriorate. And then that's the situation where you can't think straight. You can't overcome the craving for alcohol. So that's a kind of a complicated story, but in practice, it's sort of simple what to do. You want to eat the best food you can, which means food that doesn't have all the processed chemicals in it that upset the microbiome. And you want to do high dose omega-3s, and you want to eliminate high fructose corn syrup. A lot of the sweet drinks, the Coca-Colas that people mix with their drinks sometimes, can really cause inflammation quite a bit. And that's probably the biggest thing people can do, is to stop using high fructose corn syrup drinks and start having high dose omega-3s. About the patient you mentioned, It's really quite true that people need a certain level of nutrients to get an effect. So I would recommend all my patients to get a gram of omega-3s, just one pill, for instance. But then recently, I realized that like some of the other mental illnesses that are treated with high dose omega-3s, people with alcohol problems really benefit from high dose omega-3s. And so my patient had been taking omega-3s faithfully for several years, um, was just having a problem, just remember to take the naltrexone or to wanting to do the right thing on the weekends. And I told her, well, just take high dose omega-3s. Take, a couple tablespoons of cod liver oil. And she did. And 2 weeks later, she hadn't had a drink. 3 weeks later, she hadn't had a drink. And she was in her 40s, and she had not gone 2 weeks without drinking since she had been in college. It allowed her to think so much better, that it just made it so much easier to take the naltrexone and to follow through with her program. And I've done that over and over again. And my patients will come to see me the first time. I'll explain to them a lot of different vitamins I'll recommend in addition to the omega-3s, but they will start thinking clearly like by the next visit. And they say, Doc, I'm really doing great now. I had one guy said, Doc, I don't think I really need that naltrexone prescription after all. The nutritional stuff that you recommended was so good. I'm just going to stop. We'll just see how that works. And he's hasn't had anything to drink now yet. So I know that it works for some people simply to have excess omega-3s. Now, I know that sounds different or weird or alternative, but actually I've done research with this with a buddy of mine named Joe Hiblin. So he did a study back in about almost 10 years ago now, where he gave people on our alcoholism treatment ward omega-3s. And I argued that we should use a high dose, but he just used 2 or 3 grams of omega-3s instead. And it didn't show any particular effect versus placebo to reduce drinking. And he was disappointed, and I was too. But he went back and did a reanalysis of it, and he hadn't published this yet, and he'll publish it eventually. But it showed that those people with alcohol problems whose blood levels of omega-3s increased over the time they were on the treatment ward, those folks stopped drinking. So it's a threshold effect. It's a dose effect. If you have enough omega-3s, it increases the omega-3 level in your brain, and that reduces the inflammation in your brain. It increases the BDNF in your brain and allows your brain to form new neurons and to grow, and you can think clearly, and the brain fog is lifted, and it allows you to do what you want to do. It allows your recovery program to succeed. It helps anxiety, it helps depression, it helps all kinds of brain processes like Alzheimer's. And plus omega-3s are really great for your heart, for your skin, for your hair. Lots of things are better because that's sort of the way humans are designed. We're designed to have a balance between the omega-3 and the omega-6. Omega-6 is what we get in our modern diet. We get omega-6 from corn oil, from soybean oil, which is in everything, and peanut oil, and all these kinds of oils that are in our fast food and a lot of prepared foods that we buy in the grocery store. All that oil gets into our body and our bloodstream, and stays there. It becomes part of every cell in our body. And if we have omega-3s, which we get from fish, seafood, and some plants, then our body and tissue is made differently because of all the omega-3 in those tissues. There's a lot to this, and when people see me on in my practice, I spend most of the time talking about omega-3s and helping them understand how their diet is so critical. And there's other things too that are critical for recovery: magnesium, zinc, all the B vitamins, thiamine. There's studies that show that certain folate derivatives are really important for some people with alcoholism, particularly those that have a difference in the enzyme that metabolizes folic acid. Those folks really benefit from the right nutritional advice. So it's sort of a complicated story, but for people that are struggling with alcohol problems and any brain problems, really, the nutrition can be just life-changing. I have a patient yesterday who just told me how her relationships with her beloved son and husband are just basically healed because she's able to control her irritability. She's not blurting out. She doesn't have impulsive writing of nasty emails or texts back and forth. She's just able to kind of control her mind a little bit better, and she's not as irritable. She's not as aggressive. We've done a lot of studies in science about omega-3s and hostility, and it really does make a huge difference. People are just able to think more carefully about their actions. I studied domestic violence from a biological perspective, and I'm convinced that a lot of domestic violence can be prevented with the proper diet, particularly with these high dose omega-3s. So you asked me a lot of questions. I probably blasted too much information there, but if you come to my website, I try to put a lot of information there as well. But maybe you have another question you want to ask me to kind of fill in some of the information that I left out, Katie.
No, I'm so grateful to you for sharing that, because for me, it's like I'm just absorbing all of this. And I think it's obviously something we can just so easily neglect and dismiss, that nutrition would play such a big role. But I mean, through your research and what you've seen with patients, that's just incredible to hear. Like, I'm motivated to go get some fish oil because I don't take any. So I guess on that front, I know there's like so many different omega-3s out there. What would you recommend for someone? Like, what kind of omega-3 should they take?
Well, that's a great question. So the short answer is fish is best. Eating ocean fish is best. Tilapia and catfish that are raised in tanks and fed soybeans, they don't count as real fish. They're not real fish. But the ocean fish is great. I try to eat tuna fish every day for my lunch, and I think that the best advice for people just staying healthy is eating fish. You know, there's a map behind you on your wall, and if you look at those countries where they eat lots of fish and have a really healthy diet, those are countries where there's not as much problem with alcohol. And we know around the world that countries where they eat a lot of fish, they have less mental health, less depression, less postpartum depression, less bipolar disorder, even less suicide or lower murder rates. It's really quite profound effect from eating fish. So if you can't eat fish every day, if you maybe you could use cod liver oil. It's inexpensive. Maybe you could take the different kinds of fish oil. There's really no good data to tell you which is best. A lot of the companies will advertise they're mercury free or whatever, and they may say they're more purified, but we don't know that that's better or makes any difference. So I recommend people try different kinds, because if one kind doesn't work for you, maybe another kind will, or maybe one kind's better, and we just don't have the data to know for sure. We do know that the mercury in fish is an overblown problem. It's not that big a deal. In fact, there's a lot of discouragement among the professional research scientists that studied omega-3s about the worries about mercury, because it's just kept people from eating really healthy fish that it really has a profound effect on the brain development of little children. For instance, if mothers don't eat fish, there's a lot of evidence to think that the babies that they have won't have the same kind of behavior when they're born. Their IQ may be lower. So we really recommend that the women eat fish when they're pregnant. Choose a fish that's low in mercury, but it's really a healthy food to eat a lot of fish. There's a lot of things in fish and seafood that we probably don't recognize as being healthy for us. But we know that the cod liver oil safe. Cod liver oil has been around for centuries. Even the Greeks talked about cod liver oil, and it's back in Britain 100 years ago, they were giving it to children to prevent antisocial behavior, and it's still thought to be helpful for that effect. So I don't know if that answers your question or not, but it's a good question.
Yeah, and I thank you for sharing that. And I know you kind of gave some general guidance around like foods to avoid and other supplements that may benefit. Is there more information on your website about this?
Yeah, I've got lots of information on my website about omega-3s and some stories about some of the dramatic changes. It's a lot of dramatic stories about omega-3. There is science behind it. We haven't done a whole lot of research about alcoholism and omega-3s yet, but I'm sure that'll come out. There's not a whole lot of financial incentive for people to study nutrition, unfortunately. When I was at NIH, it was a great opportunity to do science, but most of the science there is devoted in developing new pharmaceuticals to help alcoholism, which is great. But the focus on nutrition that we had several decades ago has kind of fallen off the radar. Everybody in the alcohol world knows that nutrition is important, that the alcohol depletes nutrients. They just don't do anything with that information, unfortunately.
Wow. Well, just to kind of thank you for all of that. Like I've learned so much, and I hope people will rewatch that and implement some of these things, because it just sounds like it can't hurt, and diet sounds like a huge part of recovery. So I hope people take away from that. Just curious, where do you see the future of naltrexone and TSM and other medication treatment methods? Do you think it will be more of a mainstream source of treatment for people in the future?
That's a great question. I really hope so. TSM and the Sinclair Method is a great window into the power of medications to help people get free from alcohol craving. And that's really, really great. I think that with time, people are going to see other medications that may work better than naltrexone. And other medicines may work in a targeted fashion like we use naltrexone. Although right now, for instance, Topamax is generally prescribed twice a day. Maybe one day we'll use that an hour and a half before we drink, just like we use naltrexone an hour and a half before we drink. And it makes sense. We don't want to have the side effects of the Topamax all day. We just want to have the Topamax in our bloodstream when we're going to have a drink, and it will block the desire to drink then. So the future of TSM is probably going to be such that people hear about it more and more simultaneously with other medications that people will use for alcoholism. And I'll just mention another thing too that's fascinating, and that is something called neuroelectric therapy. It's a device and a method of putting electrical stimulus through the skull that may help people overcome craving for drugs. Probably this will be something that could come out for alcohol. It's been in the research world for a couple of decades at least, but it just hasn't been developed. Maybe one day that'll be developed too. And of course, that's without the side effects that medications have.
Wow, that's amazing. So where can people find you online and your work?
Sure, I'm at alcoholrecoverymedicine.com, and people come to my website and click on the make appointment button, and we have a nice discussion about where they are individually and which medicine might help for them. Or a lot of times people have problems with the Sinclair Method, and they give up. And there's so many options to have besides just naltrexone that I can help them with. That's what I like to do the most. And I like to include everything that we know about treating alcoholism in my treatment plan for them, because although the alcoholism craving is a big problem with alcoholism, people continue to drink even if their craving goes away, and they continue to get in trouble with it. So I'm all about trying to incorporate everything we know about alcoholism treatment. I'm a firm believer that the 12 steps of Alcoholics Anonymous really help people stay sober and safe and live a better life. I'm convinced that the groups that you hold, Katie, and that the meetings that people go to help them stay recovered are really important. Because when somebody stops drinking from the beneficial effect of naltrexone, they're always at an increased risk for starting to drink again. Maybe something bad happens, their dog dies, they lose their job, and they just feel sad, and they remember, well, when I had something to drink years ago, it made me feel better, so I'll just have another drink. And of course, we all have heard stories where that leads to more than just one drink. And I don't want that to ever happen for any of my patients. I want people to be free. And the way you get free is you have a life that's full of joy and has no reason to go for some chemical pleasure, where you've got a real life that's full of happiness and satisfaction. That's kind of what the goal of alcoholism treatment is in my mind.
Yeah, I really agree with that too, because I see people who do well with the medication and their desire to drink goes away, but they're in that habit of drinking for a way to cope or just out of boredom. And so I couldn't agree with you more. It's more than just the medication, though. The medication and nutrition, as you've talked about, are huge components. So um, thank you so much for your time. This was such a valuable conversation. I appreciate you sharing everything you know with us, and hope to talk to you again soon.
Great. Thank you very much, Katie. Thanks so much for all you do with the Embodied Daily group. It's just such a blessing to so many people.
Oh, well, it's my joy, truly. You talk about having joy in your life. That is certainly one of them. So, and
That's
back
great.
to you.
Thanks
All
very
right.
much.
Bye.